Good day, and welcome to NACTV's Coffee Chat. My name is Lyle Watson, and this is the month of June, and June is designated as Men's Mental Health Month. So we're very thankful that our guest today has agreed to come and join us, and he is from the Philippines, and his name is Joe Galao. And Joe, we thank you for taking time to join us here, talking about June Men's Mental Health. And your family and some of the things that you've gone through in coming over to Nipoa to live. So thank you for coming and welcome.
My pleasure, Lyle. My pleasure.
How long have you been here in Nipoa, Joe?
I came to Canada April of 2022, and I've been here in Nipoa ever since.
Ever since?
Yep.
And you are employed by High Life?
Yes, I am still employed with High Life.
With High Life.
Mm-hmm.
And I'm going to go to your family situation first. We're talking about mental health, and June being the men's mental health. Your family is not with you at this point in time?
No, not yet. Hopefully soon.
And you've been here for a number of years. That's like 3 years plus. How has that affected your mental health? And what are some of the things that you've learned to do that helps you cope with the fact your family isn't here with you?
Yeah, it's been tough, especially during the first year that I was here, because I used to take care of my kids full time. They grew up right beside me. I put them to bed. They wake up at the same time I wake up. So that's kind of difficult, especially with the distance.
Yes.
It's not easy to be far away from the person, the people that you're doing this for. It's a tough sacrifice, but for their future, I went here to build a life. I found it comforting that I'm still able to communicate with them with modern technology.
Yes.
Because when I was growing up, I didn't have that. I didn't have the option to talk to them where I can see them on a screen. My dad used to be a migrant worker, like I am, so I made sure that I keep in touch with my kids. I make sure that they know that I'm present in their life.
Yes.
And
how many children do you have?
I have 3 daughters.
3 daughters?
Yep, 3 daughters. My eldest is 15. The second one is 11. My youngest is 10. So yeah.
Yeah. Have you been back to the Philippines to visit since you come?
Mm-hmm. I've been back to the Philippines a year after I got here. I went home for my birthday, October of 2023. Yeah, but I was only able to spend around 10 days back home, because that's the only holiday that I had.
Yeah.
For that time, and I wanted to come home this year too, but situation didn't. My situation wasn't in favor of me going home for this year, so maybe by the time that I have to pick them up to get them here, that's when the time I'll be going home.
Joe, could you share us what some of the downside of being away from your family and how it affects you mentally, not being able to see your family on a daily basis and being so far away and working in a foreign country?
Yeah, the downside of being far away from my family is the difficulty of making sure that they're healthy, they're safe, they're growing up they're growing up how you want them to grow up, because it's although they're with their grandmother, their aunt, their uncles, it's still different when you and your wife or your significant other yourselves are raising your children.
Yes.
It's a matter of trust to trust with other people on how they would raise your own kids.
Yes.
And you just gotta do what you gotta do to make sure that you can give them the best life that they deserve.
So at this time, living in Nipua, working at High Life, you feel confident that you're able to offer your children and your spouse a better life when the day comes that they can join you?
Yes, yes, definitely. Because work-life balance is very different from back home and here. Because here, even though you're not, even though if you're earning just enough, you can still provide what they need and what they want.
Yes.
Because Canada offers universal health care. The purchasing power of the Canadian dollar is very much different from the purchasing power of the Philippine peso.
Ours
So,
is better?
yes.
It is,
Speaking
yeah.
of which, because to tell you honestly, if I can still remember the last time I was home, the minimum wage, the minimum daily wage, not hourly wage, daily wage back in the Philippines is around $20. That's a daily wage.
A daily wage.
Mm-hmm.
Wow. And here that would be compared to an hourly wage, I
Yes.
suppose, or better.
Mhm.
The hourly wage would be better. What are some of the things that you found that you could do, participate in, and how you help yourself get through this time, and what you do for for the betterment of your mental health, Joel?
Well, there's a lot of things that you can do for that. For me, what worked was having someone I can talk to who can just listen and who you can open up to, and also have a positive view of life. Then also, if you can, keep yourself healthy, not just mentally but physically.
Yes.
You need to take care of yourself first for you to be able to take care of the people that you love, the people that you're doing this for. You should also be able to find a positive outlet in life, like find a good hobby, learn to cook, read a book. For me, I went riding bikes, going to the gym, fishing, and then eventually hunting.
Mm-hmm.
Then recently, I was able to join a pageant when I was asked to represent my region during the Filipino Heritage Month, and luckily I won the pageant.
You did.
Yes, I did.
And
So that helps a lot.
so that keeps you involved for the coming year, then, does it, or how does that work? Is it just a monthly thing that you're the king of the Filipino heritage, or is it a yearly thing, or?
Hope. Well, as of now, this is the first time that we've held the kind of pageant that we did this year. Usually, it's for a pageant for kids, teenagers, or young adults. But this year, we held a pageant for the mom and dads. So
Okay.
it's kind of different, but it's fun, and the organizers are hoping to either do it as a yearly part of the celebration or every other year, depends on the feedback of the people.
So over the coming months, weeks, and months, as with that designation, do you have a responsibility? Do you help your fellow Filipinos, or is there a responsibility that goes with it?
As far as I know, it 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 doesn't come with a responsibility, but as yourself becoming a representative or your region of during the Filipino celebration, you do what you have to do to be involved in the community, volunteer, help out whenever you can, help out wherever you can, and doing this interview is, I believe, a part of that.
Yes. Yes, I think that it's a good part of
It
it
is.
too.
It is a really good
Because
part.
we can learn and from you and vice versa, hopefully.
Yes.
Yes. Now, you indicated you come as a foreign worker with High Life.
Mhm.
Does High Life have a program in place to work with the foreign workers in terms of their mental, physically physical and spiritual well-being, or is there a program out there with High Life?
Um, Honestly, I can't remember if High Life, the company itself, has a program within the company,
Yeah.
but our our insurance covers consultations with professionals who can help with mental health issues and mental health well-being.
Okay.
Hmm.
And what I think I'd like you to share with our viewers is sometimes we don't realize what type of shift work do you do out there, and how many employees are there, for example?
If I remember correctly, we're around 1,700 employees in High Life.
Yeah.
I specifically work for the sub-department of shipping. My designation is Japan loader. So I physically and manually load containers, like boxes of products in the containers.
Yeah.
And my shift starts from 4 a.m. till 2 in the afternoon. So that's a 10-hour work shift, 5 days a week.
5 days a week.
Hmm.
So mentally, that must be a challenge, just getting up that early every morning and getting home later in the afternoon type of thing.
Yes, it is, especially during the first few months that I've been there. Because when I got here, I started for the kill floor, which had a regular start time of 8 in the morning, and then you'll be done around 4, 5 in the evening. But right now, I get up at 2 in the morning usually to be able to prepare myself for the day, make breakfast, pack my lunch, and then be at work before 4 in the morning. And then when you get home, it's either you're exhausted or you're exhausted enough to take a nap or just go straight to bed and then wake up the next day.
Yeah.
It's especially difficult during the summer period because the sun's out till
Yeah.
10, 11 in the evening, which makes it a bit difficult to follow your biological clock.
It's, on that point, getting out and getting the natural rays of the sun and the fresh air and the things that go with nature is a big benefit to one's mental health. So how do you fit that in, working that shift and being exhausted when you get home?
Yes, that's actually true. That's actually a challenge for most of the workers in High Life because we spend more than 8 hours indoors with artificial light, and most of the employees there, well, majority of the employees are in temperature controlled environments, which is really cold. Me myself would make sure that I would spend at least half an hour, a few hours outdoors, safely, of course, because you don't want to be out in the sun in the middle of the day during the high noon or something like that. If not possible, especially during the winter time, I would take vitamin D supplements because vitamin D naturally comes from the sun, and that we need that for our health, and that's the only way I can think of.
Yeah.
Coping up to the needs.
Now your day-to-day routine at your workplace is physically demanding.
Mhm.
So how do you, when you get home and you get enough energy to get up and go, it's important to get a different type of exercise
Mhm.
and use different muscles, is it not?
Yes, it's very important, especially for my specific job. Although it's a full body workout at work, the routine, the movements will be the same. It's usually just your upper body. It's so minimal to move your lower body unless you're out doing your documentation when where you're walking around, making sure that your documents and certificates are good. When I get home, I would first try to relax, to be able to properly um, give myself time to do other activities. I would go out to walk, run, bike. Used to go to the gym every day after work, but unfortunately, I'm still tending to an injury that I want to make sure that I heal up before I go back to the gym.
Yeah.
Because putting additional workload on your muscle, on your body, will not help you uh, get back on track on a timely manner.
Yeah.
Yeah.
What about the social aspect of your life? Your family's not with you, so that kind of
Mhm.
eliminates that social
Yes.
possibility. And sociability is one of the key factors in men's mental health, as I understand, and I know personally I've experienced that too. What do you do for your social aspect of your life, Joe?
Well, for the social aspect of my life, I have different circles outside of work. There are people here in Ipoh that I met that I treat as family. There's a couple of family here who treats me like family as well. The people, the first family that I met who didn't see me as a stranger was the Douglas family. Heather and John treated me as one of their own and introduced me to their circle. I would be around them every week, every other week, just having dinner, having drinks, or just being out on the porch having a conversation. And also, my friends from Brandon, who treats me like one of their own, welcome me with open arms. They would let me stay at their place. We would be out. I would join them for their like festivals, just like what we did with the Filipino heritage. And of course, Filipinos, they're very very hospitable. They're very very welcoming. Um, I've, the moment I stepped in Nipua, a Filipino family welcomed me. They opened their doors for me to stay at their house. I've been thankful to that family ever since, and every other family that helped me after.
We're talking about the Filipino parade here the other day. I was totally amazed by the number of people and the number of Filipino people that live within our community. Do you have any suggestions? Have you been able to join any of our cultural groups, or is there some way, or what's your thoughts on getting your culture, our culture together as a community?
Yeah, that's a good question there. Yes. Well, officially, the only cultural celebration that I know I have joined every year or every other year is the celebration of the Canada Day,
Yes.
Victoria Day, like your holidays here.
Yes.
Because most of those days is when Canadians would literally celebrate their culture, their
Yeah.
country. And what I did to immerse myself is to go out with my Canadian friends. And for me to share my culture with them, I would start by um, making them something that's unique from my culture.
Yep.
Like our dishes.
Yep.
I would cook for them. I would show them some traditions
Yes.
from back home. When I got home, actually, when I went home, actually, I went to buy some souvenirs that I gave to my friends here, and they loved it.
Yeah.
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 And that's one way I express myself, and that's another way that I make sure that those people that shares their culture with me gets to share the experience of my culture.
Yes. Is there quite a difference in the food and the preparation of different dishes between the Filipino culture and our culture here?
Yes, because the Philippines has been colonized by different countries, different cultures from from the time it was discovered by Spain. So the Philippines itself is very multicultural. Most of our food would was influenced by the Spaniards, and then the Chinese, and then the Americans. So Filipino food takes so much time and um, so much delicate preparation.
Does it?
Yeah, uh, that's why when we cook, it's an expression of love, and it's an expression of care. Because when we cook our dishes, we put the effort to make sure that it's not just tasty, it would be fulfilling and healthy.
And that becomes part of the a big factor in one's mental health well-being. You said prepared with love,
Yes.
and that association with food and the culture itself is a big point in terms of your mental well-being, I would think.
It is.
What about the other thing that affects men? Of course, number one is they're reluctant to talk about the mental health and their own personal situations, or sometimes they're hesitant to listen to somebody that may have mental health problems. Did you find, or do you find that in your culture as well as our culture, or is that a common thing between men?
I think it's a common thing about in men, but in my culture, I grew up in a stigma that men has to be the tough gender.
Yep.
Because in the Filipino culture, the man is the one that is viewed as the breadwinner, the provider. So growing up, we experienced having a difficult time of expressing ourselves, because expressing ourselves is viewed as weakness, and it's very important to for a person, not just for a man, to find someone he can trust, he can talk to, who will just listen to him without reacting to the situation, to whatever they're gonna hear. Um, it's very very important to be able to have someone who wouldn't have an opinion unless they're asked to, when it comes to opening up. Also, being in Canada, I believe that uh, opening up as a man regarding your mental health issues, mental health in general, is much easier because of the support system. Like, you can just go to a professional and or call a hotline and have someone to talk to.
Mm-hmm.
That makes a huge difference.
Is that services available in the Philippines too?
Currently, I think so.
Yeah, yeah. The fact that we are men and we can talk about mental health. That's what the month of June is about. We're not less masculine because we talk about our mental health issues.
Yeah.
And it's hard to get that across to a lot of men that I know too.
Yep.
That they just it's not manly to talk about their mental health situations.
Yeah, I believe that. Because of the stigma that men should keep their emotions within themselves.
Yes.
But that is not good. That will not help you. And just because you express yourself doesn't make you less of a man. That that is something that we should understand. We were given emotions to be able to express.
Yeah, yeah. So we can encourage men to express themselves without that stigma
Mm.
attached to it. Yeah. Some of the signs of men in particular, being that June is Men's Mental Health Month, some of the particulars of recognizing or seeing a person that may be struggling in different situations, like overeating, drug abuse, alcohol. Does your culture run into the same type of things?
Yes.
Or you can see that those three things, they point to someone that may be having trouble?
Yes. That's something that they call coping mechanism, and it's very common back home in the Philippines to see men struggling and end up doing those things.
Yeah. So, in terms of yourself or me personally, do you ever approach somebody that you think may be having a problem, just asking them how they are and how important that could be to a person?
In all honesty, I don't assume if someone would have mental health problems, but I would always ask someone, no matter how they look, no matter how they express themselves, how they are.
Yeah.
Like in general, like I would greet them, "Good morning. How are you, sir?
Yeah.
How can I help?"
And if the answer is, fine, I'm doing well, and yet if you thought there could be something in his life that is indicating he's having some issues, would you ask him a second time, or is it just?
There would be indications that I would ask them. I would tell them that I can listen, we can talk, something like that.
Yeah, yeah,
Because you would know if you yourself has been in that situation, you would notice the body language, the energy that's being projected by that individual
Yeah.
towards a question.
yeah. And it's important for us as friends and family to give that person an opportunity to express themselves about their mental health. Yeah. You mentioned friendliness, and I noticed that the Filipino people I meet on the street, and I've never met or don't know, they always, it's hello, good morning,
Yes.
whatever. And I think that's important for everybody's mental health, is to share that good feeling about being friendly.
Of course.
Yeah. Well, as usual, our time limit slips away on us. We've covered a number of points. I'm wondering if there's something that you could share or would like to share with our viewers, Joe, as to helping to better our men's mental health and to get us more open and to rid ourselves of the stigma of men's mental health.
Oh, I have something that I always use for myself. Aside from keeping yourself healthy, believe that you're worth it, and always take a step, because the first step would be your biggest step. You can take the risk. I always believe that 1% of something will always be better than 100% of nothing, because if you do something, if you're able to start something, then you're getting somewhere.
Yeah. Oh, that's a good point, to start someplace and be thankful somewhere along the line, and like you said, you are worth something.
Yes.
And we all have a value in our worth for our loved ones, family, and our communities.
Yes, indeed.
Well, I certainly want to thank you, Joe, for taking the time, and obviously the stigma of talking about mental health you've not overcome it, but you know how to handle it.
Mhm.
So we appreciate you sharing those views and thoughts with our with our viewers, and I thank you on behalf of our viewers too.
Anytime, Lyle. It's been a pleasure. It's actually an honor to be asked to be part of this interview for the Men's Mental Health Month of June.
Good.
Yep.
Well, and I hope that your family gets to join you sooner than later, and we look forward to meeting them when they come too.
Oh, me too. Me too. I
Good.
can't wait to be with my kids again.
Well, thank you very much, Joe, and you take care.
Thanks. Thanks. Have a good day.
Well, that brings our this coffee chat to a conclusion. I hope that you have taken the time to stop and listen to a few points that Joe has made, and remember that the stigma of men's mental health can be overcome one step at a time. And until then, I hope that you remain healthy and happy, and hope you'll join us next time. My name's Lyle Watson. Have a good day.